excited to have such a high number of folks who dialed in, and we're really excited to share with you more information and give you some additional context around this request for proposals. Our goal here is to answer as many of your questions as we can. Any questions that we are not able to actually get to during the course of this webinar, please send them in and we will address them online. We're going to do an additional update our website to reflect questions and answers. And if somebody who is listening could just send us a quick message to make sure that you're hearing us, so that we're sure that. Great, wonderful, thank you so much, we really appreciate it. So just some quick background before I hand it off to my colleagues. You're hearing from me, Lynn Overman. You'll also be hearing from my colleagues, Nikki and Alex. We are going to walk through what our goals are as a team here at the Foundation for this request for proposal. We will review the solicitation and give you some additional context as to what it is that we are particularly interested in so that you can target your LOIs to maximize the opportunity for an invitation for a full proposal. We will walk through frequently asked questions that are common for our processes here. We'll share some additional resources and we'll talk about next steps, and then we will open it up for questions and answers. There is an actual box that I think several of you have already figured it out for chat that you can ask us questions. Any questions that we cannot get to, again, we will go ahead and track those and make sure that we're responding to them online. We are also recording this webinar, and we will share a link to this afterwards in case anyone has to jump off or for folks who weren't able to make it. So quickly, our Alternatives to Arrest portfolio is a relatively new portfolio here at the Foundation, but it's one that we are very strongly committed to. The overarching goal for this portfolio is to reduce harm during emergency response to individuals who may be in crisis, and to increase opportunities for individuals to be directed to places where they are more likely to receive targeted and effective treatment. We really are interested in understanding which models are most helpful for that level of pre-arrest diversion and to increase opportunities for folks to get the treatment that they need for the underlying issues that might be driving them unnecessarily into the emergency response system. So our goals with this RFP are really across kind of two really important vectors. One, we are particularly focused on populations that are of a high priority for us, people who are experiencing homelessness, people who may have mental illness, people who have substance use disorders, with a particular focus on opioid use disorder, although we're very interested in substance use disorders writ large as well. We certainly recognize that there's a large amount of overlap between these populations and are also very interested in understanding models and interventions that can affect multiple of these issues at once. Additionally, we're really interested in understanding different models for effective response across key points of contact. So what we've certainly seen as we've done this work and talked to communities across the country is that we know that folks with these particular challenges can often cycle into crisis or come into contact with emergency response. So with police departments, with fire, with EMT, at the moment of emergency response, when people are in crisis, we're really interested in understanding models that will help ensure that everyone can leave those situations safely. So we're interested in opportunities to de-escalate mental health crises safely, very interested in opportunities to reverse substance use overdoses, and anything along those lines at that moment of immediate crisis. After the moment of crisis is resolved, we are very interested in understanding what is most effective for immediate post-crisis stabilization, including alternatives to arrest. So the goal for these interventions is to divert people away from the criminal justice system and, where possible, away from acute emergency health responses that may not have targeted treatment. And then finally, we're very interested in opportunities to understand which interventions are actually most effective at treating the underlying issues that might be driving people into the emergency response system unnecessarily. So we're very interested in interventions for people with a complex array of needs. Our ultimate goal here with this portfolio is try to get people more seamlessly connected to preventative treatment so that we are reducing their utilization of emergency response. So with that, I'm going to turn it over to my colleague, Nikki, who's going to talk in a little bit more detail about exactly what we're looking for at each of those points of contact.
Thank you, Lynn, so much for that overview. Just as a reminder for those who are just joining us, there is a Q&A box to the right corner of your screen. If you have questions, please feel free to post them there, and we will try to get to as many questions as possible. As Lynn just mentioned, we're committed to working with jurisdictions to evaluate interventions that leverage partnerships between police, fire department, and EMS, and also to divert individuals who experience homelessness, mental illness, and/or substance use disorders with a particular interest in opioid use disorders. Let me take this time to walk you through and I've jumped ahead too quickly, to walk you through the 3 areas, and then I will turn over to my colleague Alex Trudeau, to walk you through the project tiers and the funding priorities. So our first point of interest is emergency response, and we're interested in evaluating programs that aim to increase the capacity for our first responders. Those are programs that are giving our first responders the appropriate tools to, 1, recognize signs of mental illness and/or substance misuse, 2, safely de-escalate and stabilize emergency situations, and 3, maximize diversion to treatment and services. At this point of contact, we are particularly interested in specialized training programs for police officers or first responders. And for many of us, we're familiar with crisis intervention training and mental health first aid training. We're also interested in understanding and getting a better knowledge base around police-initiated crisis response units. For example, crisis intervention teams. This is possibly the most familiar to many of us, and these are programs that have a community partnership among law enforcement, mental health, and addiction professionals, individuals who live with mental illness and/or addiction disorders, their families, and other advocates. It's considered a first responder model of police-based crisis intervention. What I want to point out here for crisis intervention teams is more than training, and we're looking for this robust intervention defined by the model of crisis intervention. Another police-initiated response that we're interested in learning about is the co-responder model, and these are teams of specially trained officers paired with mental health crisis workers to respond together to mental health calls for service. This is a really unique intervention and initiative by drawing upon the combined expertise of the officer and mental health professional. The team is able to link individuals with mental illnesses to appropriate services or provide other effective and efficient responses. One other model I'll mention, and then I'll move on, is the mobile crisis teams. Mobile crisis team is a group of mental health professionals who are available to respond to calls for service at the request of law enforcement officers. The mobile crisis team's goal is typically to divert individuals from unnecessary jail bookings and/or emergency rooms. And there are other models that are out there. For instance, there's a case management model that is more associated with law enforcement. Again, a partnership between law enforcement and behavioral health professionals to really try and respond to individuals in a timely manner and get them linked to services. Our next area of interest are post-crisis stabilization. And at this point of contact, We are very much interested in evaluating facilities that are alternatives to arrest or hospitalization. So we're looking to learn more about post-crisis facilities, and we're seeing them emerge more across the country under different titles. For instance, some of you might have heard crisis stabilization units, crisis response centers, crisis diversion facilities, etc. And some of them having co-located services, including, and they have different configurations. So we're seeing some with just mental health crisis stabilization, or some that are medically monitored detoxification or sobering facilities, or we have others that are combinations for both mental health and substance use disorders. All of these referring individuals to treatment and services for a continuum of care. At this point of contact, we're particularly interested in effectiveness and cost benefits of these facilities. So is the use of these facilities decreasing arrest rates and the use of acute emergency services? Are they in fact stabilizing an individual post-crisis? And how are they increasing engagement with long-term treatment? And our third area of interest are treatment programs and services. We're interested in building the evidence base for treatment programs and services to help individuals experiencing homelessness, mental illness, substance use disorders, or OUD, to reduce unnecessary encounters with the criminal justice system and the emergency response system. All this to improve individual outcomes, to generate public cost savings, and to increase uptake and continued engagement. Of particular interest to us at this point of contact is the rigorous evaluations of programs backed by promising prior evidence. For example, Housing First. For some of us, we're familiar with this. It's an approach to quickly and successfully connect individuals and families experiencing homelessness to permanent housing without preconditions and barriers to entry. There's also forensic assertive community treatment and/or assertive community treatment, typically called ACT. ACT is a psychosocial intervention developed for people with severe mental illness who have significant difficulty living independently, need high services, and have repeated psychiatric hospitalization. FACT is an adaptation of assertive community treatment for persons involved in the criminal justice system. Other examples of areas that we're interested in for this particular point of contact are critical time intervention, coordinated care, and connective behavioral therapy, and others. I'll take this time now to turn over to my colleague, Alex.
Thank you, Nikki. And my name is Alex, and I'm the research director here on the policing team. And I'm going to go through a few points about the mechanics of what we're looking for in evaluation studies and then your proposal. To start, we've got three different tiers at which we're evaluating prospective research studies, and they're labeled impact evaluation tier, innovation tier, and descriptive tier. The impact evaluation tier is intended to identify interventions that are promising or that are effective, and to be able to design rigorous evaluation studies, preferably randomized controlled trials or RCTs, or rigorous quasi-experimental designs, particularly ones where there's comparison groups, in order to determine whether or not there are strong effects. The innovation tier is designed to better understand either untested interventions or to assess feasibility of an RCT or other rigorous quasi-experimental design down the road. So you could have a proposed study which involves, at the innovation tier, which involves feasibility of an RCT, but that would also, contingent on the results of that feasibility analysis, include a follow-up RCT. So we can include process evaluations, logic model testing, and as I mentioned before, feasibility studies here. And then the descriptive tier is really designed to address major gaps that we have in understanding how some of these interventions are being deployed, how they differ from each other, and to be able to identify patterns within data that otherwise are difficult for people to get their hands on. So it's designed to help us understand a little bit better how, it's designed instead to make basic information about some of these interventions and the populations involved with these interventions available to as wide an audience as possible, preferably across multiple geographies, and in some cases across different interventions as well too. Some of our priorities in terms of research design here can be broken down into 3 different categories here for outcomes: short-term, long-term, and then cost-benefit analyses. We recognize that there are short-term outcomes involved with many of these interventions, involved reduced likelihood of arrest, de-escalation and stabilization, and other diversion outcomes that are really measured right at or very shortly after point of contact with the intervention. And so we believe that there's plenty of good, strong research studies to be done looking just at the outcomes at the short-term basis for these interventions. There, however, are also long-term outcomes that we're interested in, some of which include ongoing use of acute emergency services, other sorts of clinical and criminal justice outcomes, and so forth. These long-term outcomes can either be associated with a longer-term services intervention, or they can be looking at longer-term outcomes associated with a crisis stabilization or short-term outcome. And again, for the long-term outcomes, it's really going to depend based on whatever is the nature of the intervention and the types of outcomes it's intending to yield. And then the third category here is cost-benefit analyses, and we're keenly interested in studies that include cost-benefit analysis as a component of an evaluation, or that are designed to provide cost-benefit analysis where there might be other rigorous evaluations already done on an intervention or a series of interventions. But generally, we would note that for many of the, especially short-term outcomes that we're talking about here, there's a real lack of cost-benefit analysis to those, and we'd like to be able to see some research studies that fill some of that gap. A few points about how our foundation thinks about research integrity, and our funding priorities around research. These are really important to understand because the Arnold Foundation has quite high standards for research funding, and so a few of them to go over here is that, first of all, we strongly adhere to open science principles. So all projects are posted on OSF. If you're not familiar with OSF, you can check that out online. We ask for pre-analysis plans, and we hold grantees to that practice quite accountable. We also have very strict standards for our methodologies. Fortunately, we have that posted online, so you can check out what types of questions that we would be asking for a research proposal. This is not something that you're going to have to address in the LOI stage, just to be clear about that. But if your LOI is selected for invitation to the formal proposal process, you are going to have to address all of the different points that we look for in our guide to research proposals. So it's a good idea to familiarize yourself with what those look like now. They're going to be especially heavy for RCTs or other rigorous quasi-experimental designs. Lastly, it's important to note that we strongly emphasize sharing data whenever possible. We realize that a lot of the data, especially in this topic, involves information that cannot be shared. So when it's possible, we ask that the data be de-identified and then shared, but certainly all reports and related sources that can be shared are expected to be shared publicly and made available. You'll see a note here that says our greatest interest is in research studies, but please don't think too narrowly about that. If you've got a really creative proposal that aligns with the strategic objectives that are mentioned in this RFP, we encourage you to include those in your LOI in order to really expand our scholarship and practitioner learning. Okay, now I'm going to go through a few of the frequently asked questions that we've already received about this proposal, or this RFP rather. First, who can apply? Our funding is available for nonprofit and government agencies. We also do provide funding opportunities for for-profit organizations. The important criterion there to note is that 100% of the grant funds need to go to project expenses, so there can't be any profit associated with it. But definitely nonprofit and government agencies are welcomed and encouraged to apply. The maximum allowable budget, this is a question we get all the time. There is no maximum budget for this particular RFP, nor is there a minimum. We will have all expenses for proposed projects are going to be thoroughly documented by the applicant, so everything will need to be fully justified. But to give you a sense of where we've funded in the past, we have projects that are currently underway that we recently funded at $70,000, at $500,000, and at $1.5 million. So there can be a wide range of funded projects. We're often asked if we require matching funds, and no, we do not require any matching funds. The typical project timeline, it can vary, but grants for the foundation typically are not longer than a 3-year period. But for longer term outcomes, there can be some exceptions made to that. We've also had a question if you are, for individuals who are running a program that needs to be evaluated, but they themselves are not researchers, are they eligible? The short answer here is please go ahead and submit an LOI. In the event that you are looking for a research team to fill in roles within the project that you've identified, that's something that we can help address with you after the LOI stage. And then allowable use of funds. We are a 501c3 organization, private operating foundation. We cannot use any funds for lobbying activities. Advocacy is okay, but there cannot be any lobbying. If you're unfamiliar with that, there's resources online to distinguish. We typically, and this is an important point about program and operating expenses, we typically do not fund any programs or services, except when those programs or services are using staff or other resources as part of the research project. So the funding is for the research project to the extent that the research project requires program staff to participate, then that is certainly an allowable and encouraged expense. There are instances, they are rare, but there are instances when an evaluation would seek to understand an enhanced or modified version of a program or service that is not yet in place, that has not yet been funded. It is possible that we would fund the enhancement of that program or service for the purpose of evaluating it, but it's going to be very important that applicants demonstrate that that enhanced program or service would be sustainably funded after the evaluation, and obviously contingent on the successful evaluation thereafter, but we would not provide ongoing support for those programs or services. We do have, we'll open up to some other questions here in just a moment, but we do encourage you, in the event that your question wasn't heard today, to please email us at the email address that you see on the screen here. It's a2arfp@arnoldfoundation.org. We're going to try our best to get responses back to everyone within 3 business days, but especially within the first couple of days after the webinar, we may be a little bit slower than that depending on email volume. Important to note that LOIs are due by November 5th. That is a hard deadline, so please, all LOIs in by November 5th. We anticipate invitations for full proposals around January of 2019, but right now that is an anticipated date, and if that date changes significantly, we'll have that information posted on our website. And similarly, we anticipate funding decisions around summer of this next year. Again, to the extent that that information gets updated over time, you'll be able to see those updates on our website. And as we mentioned before, that all RFP updates are going to be available on our website at this address, but you'll also be able to find it just by navigating from our homepage as well. All right. Now we're going to open it up to questions that we've gotten in so far. The first one is about whether or not we have an interest in evaluating existing or new programs. The answer is yes. We are particularly interested. I would say that we are more interested in existing programs as opposed to prospective new programs. But please don't think of that as a reason not to focus on a prospective program. There would just need to be a strong case made for that prospective new program. However, the research, unless it was like a needs analysis done as part of the descriptive tier, that would be a way to focus on a prospective new program, is to understand, for instance, what types of conditions out there are not being met by one of the priority populations we mentioned, and therefore what would be taken into account in developing a new program idea.
Great. We got another question. Are we interested in non-police response units? The answer is yes, we are. Would be interested in those non-police response units that are specifically targeted at the populations that are our priorities. So non-police response units that are responding to mental health crisis, substance use overdose, or are engaged with people experiencing homelessness. We consider that a component of pre-arrest diversion. So would certainly encourage LOIs that would address those issues.
One question about whether or not universities are included as nonprofits. Yes, absolutely. Universities are encouraged to apply. And I should note here too that for all organizations, university and non-university nonprofits, we do fund overhead as part of our grants. So that should make things a little bit easier for applicants.
Alex, we have another question under the descriptive tier. Is the foundation interested in surveys, portraits, documenting the national landscape around how police are responding to mental illness, homelessness, and substance abuse?
It's possible. It's really important that when you're writing your LOI, that you make the case for why that project is so important, given what we've laid out as the strategic objectives in the RFP. There's, a near limitless number of interesting research projects that can be done in this space. The real question for us as a foundation is what types of gaps in information can be filled through studies through one of these different tiers that most advances the strategic goals laid out within the RFP. So please be mindful of that in justifying your proposed study.
We got a question about whether or not we have a preference for a particular size of a jurisdiction or county. We certainly encourage governments and counties of any size to apply. We are very interested in understanding how different sized jurisdictions address these needs, and we're really committed to ensuring that not only are we looking at effective models, but we're understanding how those models are effectively deployed in different circumstances, so different geographies, different sizes, different capacities. So we certainly encourage small counties, medium and large to apply.
We have a question clarifying the time deadline for LOIs on November 5th. Midnight will work. Sorry, I guess 11:59 p.m. How about that? So don't worry about it being an earlier time in the day on the 5th. And then anticipated deadline for full proposals. That's a good question. We'll say that we'll make sure there's plenty of time to develop a full proposal after there's been an invitation. I think the more important point to note there is that we consider the proposal development process to be a partnership. So as a team here, as a staff at the foundation, there will be some back and forth where we'll ask questions, we'll perhaps make suggestions or ask for things to be clarified a little bit during the proposal process. So those represent ongoing conversations, and it's less about a firm deadline for when those get turned in. see here, other questions.
Let's see. Funding for program implementation.
The question on funding for program implementation, generally no, unless it's integral to the design and implementation of the evaluation itself. And again, if a new program or an enhancement of a program would result from the evaluation, there would need to, in order for us to feel really encouraged about funding that research proposal, we would need to know that it's highly likely that that program would get sustained financially going forward after a successful evaluation. Will the links to the webinar be live? You will be able to link from, we'll make the slide deck in this webinar available on our website as well too, so you'll be able to link directly to the sites from the slide deck there. And is there a maximum number of LOIs that an organization can submit? No, there's not. However, think about it more in terms of the research team involved, and we certainly will have questions for an organization about their capacity to implement multiple studies at one point in time. But if it's a large organization, for instance, with multiple research teams within it, no, there's no restrictions on how many can come from one organization.
Great.
All right, we're getting closer here. Are we interested in non-RCT evaluations if an RCT is not feasible? Yes, absolutely. It will be really important that you briefly demonstrate within your LOI why the RCT is not feasible. It's important that to have the rationale be something other than it's too expensive. The cost is not a good reason to avoid the RCT. Rather, actually being able to randomize or the randomization protocol being problematic in and of itself, those would be reasons not to do an RCT, not just because it's otherwise too expensive or too challenging. So please just document carefully why it's not feasible. And then, can a government entity awarded a grant under the RFP utilize a for-profit organization to implement the study? Yes, that is certainly possible, and we've had a number of grantees who've taken that route. Again, we'll work out the specifics of what monies go where within a budget during the proposal development process. And again, it'll be really important that any for-profit entity document that 100% of the funds it received went to the project expenses and not to profit. And then, is there a possibility of requesting shorter turnaround on LOI and or on start of contract due to a program that's funded and will be starting earlier than summer 2019? I'm not sure.
Can you like fast
Can we fast track? Yep.
Fast track.
LOI, can we get them at an earlier date?
Well, you are welcome to submit an LOI anytime you'd like, but that does not necessarily mean that we'll be able to speed up the formal proposal and board review process. So please go ahead and submit it, and if there's a consideration around timing, please be upfront with that, and our staff will be able to review that and get back to you right away to determine whether or not that would create problems down the road. And are there any specific populations besides diversion aspects of interest? Go ahead, Nikki, please.
It would have been good if you had just asked that question a little more specifically. We are really interested in the populations that were mentioned. However, I know that some are interested, for instance, in looking at populations of youth or juveniles, and we would be interested in that as well. But for now, the populations of interest remain mental illness, homelessness, substance use disorder with a specific interest in OUD.
Yeah. And a particular focus on diversion. So we are not interested under this RFP in evaluating post-arrest court interventions or anything kind of further involved in the criminal justice system.
Is there funding only for the evaluation, or could it support planning and operations for the program that is being evaluated? To to the extent that the planning or operations funding is necessary around the evaluation, yes, that can be included in the proposal. As an example, if an organization is planning on launching a new multi-agency response team, and the evaluators want to do an RCT of that intervention. If the first part of that study design is working with the agencies to clarify their protocol, because that is going to be necessary to ensuring fidelity to the intervention during the proposed RCT, then yes, absolutely, that planning process can be part of the evaluation. Again, as long as it's germane to the evaluation, then we certainly are open to funding it. Question about, will there be an opportunity to revise and resubmit? There will be on the formal proposal phase. There likely will not be on the LOI phase. You have a project that overlaps with all three tiers. Is that acceptable? And what's a good way to organize the LOI to make the different components of the project clear? I would encourage you to, if it overlaps with all three tiers, then it likely, we would think of that as just the impact evaluation tier that has other components that lead up to that impact evaluation tier, and so I would organize it that way. Is there interest in a methodological project that focuses on existing and/or new data to strengthen/advance the methodological rigor and evidence building process in this area of work? So is there a methodology research study? Yes, possibly, as long as you were able to demonstrate that with the results of that study, that would somehow enable a lot of scholarship that has yet to occur in this area. For instance, if that's a significant barrier to scholarship in this area, then that aligns with the strategic objectives, then yes, that would be potentially an interesting study.
Does post-crisis stabilization have to include a facility, or can it be community-based programs and services delivered to delivering the short-term care services? Absolutely. We were using our overarching goal is understanding effective approaches to post-crisis stabilization. We're not wed to any particular facility per se. The goal is the effective stabilization. So we would certainly encourage LOIs of programs like that.
So we're getting a number of questions about individual studies and whether or not those would be of interest to us. To be fair, so that not every person has to float their study design bias. If you're concerned about whether or not it lines up with the LOIs, with the RFP's objectives, please go ahead and email that to us, and we should be able to give you a quick reply on that as to whether or not it generally fits with our objectives. There was a clarification question around whether or not the intervention has to involve adults, and no, it can involve juveniles. Let's see. Okay, in the LOI, is it correct that we should address all of the 5 criteria but focus on the first 2? I'm not sure I understand.
Yeah, so I can answer. The LOI, there is 5 criteria outlined in the LOI, but we also acknowledge that it is we're limiting it to 3 pages maximum. So within the RFP overview, it does highlight that I believe the first 2 or 3 criteria are of the utmost consideration for the LOI, and that's just, does it fit within the LOI request, and the strength of the research team, and an overview of the study, acknowledging that you won't be able to go into the details of the methodology.
We have a question on how many projects will end up getting funded. The short answer is we don't know. It depends on just the number of projects that meet the criteria that we're looking for. So we don't have, there's not a firm number one way or the other.
Yes, and there is no limit. So the limit may be our capacity, or depending on the number of proposals or LOIs that are similar. but we don't have an upward limit, and our board in the past has consistently funded any strong research proposals that are tightly aligned with our goals. So there is no upward limit, which is always a good thing.
There's some questions around program-related expenses. So how to justify a prospective program. First of all, again, focus on the strategic objectives of the RFP itself. Understanding who we're focused on, what types of outcomes that we're looking for. If the prospective program is very, very closely aligned with those priority populations and with those particular outcomes, and is building on a body of program work where additional work is needed, then that makes a whole lot of sense. But again, justify it in terms of the strategic objectives of the RFP itself. Also, another technical question about program-related expenses. Without going into too much detail, again, if the program staff are contributing, or any program resources are contributing meaningfully to the research project, then yes, absolutely it gets funded. If the research project needs that program participation to happen, then of course that would be part of the funding. And is the foundation interested in single site and multi-site studies? This is a really good question because it matters a lot for some of the research studies that we've funded in the past. For descriptive tier studies, if you're just trying to assess what is, identify gaps, etc., then it's really important that you factor in multiple geographic areas, multiple sites into the study, because we want that information to be as generalizable as possible. If you're doing an RCT, I'll go to the other end of the extreme here. If you're proposing an RCT, then the multi-site criterion is less important. However, to be able to do an RCT across multiple sites, a really well-designed and well-implemented RCT across multiple sites is something that we are often looking for as a foundation, and we love it when those types of opportunities come up. But even a well-designed RCT within one geographic area for a program that is clearly defined and the results of which would be applicable to a wide range of practitioners, that's something we're certainly interested in funding as well. Do any of the three tiers have priority? No, they do not. The priority is really more about what the results of the evaluation will yield in terms of the strategic objectives of the RFP and the impact that would have within the field. Okay, I think we're nearing the end here of the Q&A session. I think we've answered that one. There is a question about other groupings of priority populations, for instance, veterans. To the extent that the population that you're focused on in your proposal is affected by the criteria that we mentioned before, if substance use disorder is a major problem within your population of interest, if mental health issues are a major problem within your population of interest, then yes, please go ahead and submit something. But again, please bring it back to the priority populations that we identified in our study and be able to, preferably clearly with some data, document what kind of overlap there is between the issues that we've outlined and the population that you're looking to study. Do we need support letters in the LOI phase for participating agencies? No, you do not. However, those will be critically important during the formal proposal phase. And then we're gonna wrap it up here, I think.
Yeah, so I think we're getting a little bit into the nitty-gritty, which is helpful for folks. So we also do not require a budget in the LOI phase. That would come through full proposal.
Yeah, we don't require an itemized budget, but we do need an estimated amount of what the project is going to cost. I think that's all of our questions. So thank you all for joining the webinar today. Again, if you do have any questions at all, please feel free to email us at a2arfp@arnoldfoundation.org. And then again, just going back to the RFP itself, we've included a lot of information about our populations of interest, about the specific programs and models we're most interested in evaluating. So please feel free to refer back to that, as that should be helpful as well. And we will post the recording of this RFP online, and we will continue to update our Q&A document as we receive additional questions to make sure we're as transparent as possible and sharing all of the information that we can to be helpful in the submission. But yes, thank you all again for joining today. We really appreciate it.